My name is Ed Stein. I'm a consulting pharmacist. I've been a pharmacist for over 30 years. I'm a retired public health service officer, and the whole time that I was a pharmacy officer in the PHS, I was assigned to the Indian Health Service. The question always comes up, why are pharmacists interested in lifestyle medicine, or why would pharmacists be involved with lifestyle medicine? Doesn't that mean that they're going to reduce the number of medications that they're on, and therefore a pharmacy is not going to make any money on that sort of thing? And that is not how the business of pharmacy is, particularly for independent pharmacists who are serving communities out there. They are interested in the health of the community that they're working with. And so to go to pharmacists and say, here's another area where you can work lifestyle medicine, another service that you could provide for the people who are coming into your pharmacy, the pharmacists are all about it. And they're very enthusiastic about, how can I learn more about this? What can I implement? What services can I provide to the patients who are coming into my shop? We think that pharmacists are probably the most accessible member of the healthcare team across the country, no matter what system that you're in. I think off the top of my head, 90% of the population in the United States lives within 5 miles of a pharmacy. And something like 80% of the country is within a 5 to 10 minute drive of a pharmacist. And the best part is, you often don't need an appointment to show up. With that accessibility also comes a great responsibility for the pharmacist. So this is just going to be another touch point where patients can work with one of their providers, the pharmacist in that case, towards the remission of their type 2 diabetes. So for pharmacists or other healthcare providers in dealing with folks who have type 2 diabetes or who are newly diagnosed, if we go in with the perspective of this is a disease where we have to manage things, then it's a big downer and it's a big challenge. And depending on the patients that you're working with, they may have a family history of type 2 diabetes. So this new diagnosis means for me, well, I'm going to have to start taking insulin injections. And then at some point I may, have to have some toes amputated. And then I might have to raise those amputations. And then eventually I'm going to have to end up on dialysis. So that's what it means for a lot of the communities that we serve. Now, imagine if we went into that initial conversation and said, okay, here's a new diagnosis, and this is what you and we can do together in order to get remission of this disease. Now, maybe the remission is possible, or it's going to be a big challenge, but it's not just merely slowing the progression of a lung disease. It's actually taking control of what's going on. And with the lifestyle medicine interventions, the patient is so much in control of what their behavior is. So if we can encourage those sorts of things and, celebrate the behavior movements in that direction and encourage those over time, then we're going to end up with a lot better outcomes.